It is Facebook Friday once again, and here we are.
Here we are.
Here we are. And Mark is been replaced by Christy, who is here running the video for us.
Turn it around, Christy, and say hi.
Hello.
There she is. All right.
Hi.
All right. So today is Good Friday.
Yes, it is.
Right? Good Friday, the day that Jesus was crucified. And when he was crucified, you gotta feel like his disciples were probably freaking out a little bit.
Yeah.
Don't you think?
Pretty
Right?
broken. Yes.
Right? Kind of freak out, okay? And sometimes we have a tendency to freak out,
Yes.
right?
I do.
Right. So I'm guilty of this. Okay? So, you know, Susanna, our youngest of four, you know, the apple of our eye, you know, getting ready to head off to college, possibly one of the smartest Gordon child, she wants me to say. I don't know if she's the smartest Gordon child, but she's real bright. Had a lot of
She
good
is very
choices.
bright.
And it took her just the regular eye appointment yesterday, and they saw something in her retina. And talk about hitting the freak out button. Man, hit the freak out button. I did just real hard. Okay, it's hard, right? I mean,
It is.
the eye is like
in your child.
in my child,
In your
right?
baby.
Right. I
Yes.
mean, at Duke they had an elective you could do called Eyes at Lunch, and they would show you pictures of eye trauma over lunch as an elective. And you know you don't want to be an ophthalmologist when you see eye trauma at
Yes.
lunch. I mean, and it
Yes.
turns your stomach, right? It's not a good thing to be. So there are people. I'm glad people. I had a hard time with my eyes. Like it took me forever to be able to put my contacts in, right? So just like the disciples, hit the freak out button. What is going on? And so fortunately we were able to get in, see the retina specialist today. It's all good, and my catecholamine levels are coming down a little bit.
Good.
But it's hard not to freak out, right?
Oh, it is.
And you gotta feel that for our patients, there's a very high freak out potential, right?
Very much so.
Very high freak out potential. We know that's true. And it is hard, right? It's hard. You want so badly to have a good outcome. And you do, and you hit the freak out, right? You hit the freak out. And I guess what I'd say is that Dr. Google is not your friend when you are freaking out,
No.
okay? Because, you go down into that rabbit hole of retina problems, and let me tell you, you're just like in total freak out mode.
And what do you tell our patients about Dr. Google?
And Dr. Google does not have a license to practice, and you need to remember that, right? And the other thing is that every case is unique, right? And you can't get that from Dr. Google, right? And of course, we all go immediately to the worst case scenario,
Of course
right?
we do.
It's like, well, tell me what the worst case is. Well, the worst case is like 1 in 1,000, 1 in 8,000. Well, I want to know what it is. It's like, but it's like not going to happen. Well, tell me what it is. So again,
Are you trying to keep
we
it
all have that
secret?
tendency. We all have. So again, hitting the freak out button is not good. So what do you do to avoid the freak out? I mean, I think we've got patients can resort to prayer, meditation, acupuncture. Go see Sarah over at Tennessee Reproductive Acupuncture. Ways to gain some control. Take a deep breath. Calm down. There are a lot of resources. We have these different resources. I mean, not the Time Life book that Dr. That's a nice resource, but it's not for helping them freak out on fertility.
Yeah,
But
no.
we do have some of these books here that are, some of them are written by questionable authors, like this one.
Like Dr. Gordon.
But there are books here, not by Dr. Gordon, not by Dr. Keenan, but there are lots of resources out there, and they guide you through this to avoid
The
to
freak
avoid
out.
the freak out. So let's try to avoid the freak out, all right?
And
it
you
is hard.
can call us.
And you can call Lynda and email Lynda. So if you're freaking out, we do want to hear it. We want to help you.
Yes.
Remember that on Good Friday, they didn't know that Easter was coming.
That's right.
But Easter did come.
It did come.
It did come. So let us remember that when we're in the freak out.
That's right.
That the sun will rise and good things will happen.
You're not going to start singing the song from up tomorrow?
No. Would you like to?
No.
Okay, good. All right. Well, anyway, this is Dr. Gordon, Lynda. Wishing
Happy
you a
Easter.
happy Easter
Happy
weekend, and we'll
Friday.
see you next week on Facebook Friday. So don't freak out.
No freak out.
No freak out. And
Have
we'll
a
see
good
you next
weekend.
week. Bye.